What is up, guys, and welcome back to my channel, or if you're new here, hello, my name is Rachel and I am a golden retriever mom of 2. Today we are going to be talking about how to take your dog's vital signs and learn what's normal versus what's not so normal. I recently took a class learning dog CPR and what to do in emergency situations that clearly does not qualify me as a professional in any sort of way. I am not a veterinary professional at all, so please do not take anything that I say in my videos as professional advice. I am a registered dental hygienist for humans. But anyways, let's get into the video. So the first vital sign that we're going to talk about is their temperature. So what is an average temperature for a dog? A dog's average temperature is anywhere between 100 and 102.5 degrees. How you can check this is with a digital thermometer, and it's going to be done through the rectum. So you're going to need some type of lubricant, some KY jelly, some Vaseline, something of that sort, and you will also likely need someone to help you restrain them because this was probably not the most comfortable thing for your dog to go through. Once you have the thermometer and they're in position, how far do you go? Whenever you have a smaller dog, you're only going to want to insert it about 1 inch. For a medium to larger size dog, you're going to go anywhere between 2 to 3 inches. Once you're in, you're going to stay in there for 2 minutes. Once you're done and take it out, your dog may very well want to defecate at this moment, and you're going to want to know if there's anything on the thermometer. Is there any blood? Is there any mucus? Is there any leftover stool? The next vital sign that we're going to talk about is their pulse. So the pulse of a dog can range based on the size of the dog. So a smaller dog is going to have a pulse of anywhere between 100 and 160 beats per minute, and a dog of a medium to larger size is going to have somewhere between 60 to 100 beats per minute. So the larger the dog is, the bigger their body capacity is, so naturally that number is going to be lower. So how do you check this? Where is the heart of a dog? So the heartbeat of the dog is going to be checked on the left side of the body where the point of the elbow meets their chest. So whenever you're checking their pulse, you ideally want to have the dog on the right side so that the left side of their chest is closest to you. Once they're laying on their right side, you're gently going to take their left front leg at the elbow and bend it back to where it reaches the chest. You will then place your hand or your stethoscope on this area and start to count the beats per minute. If you have a dog that is of a larger size, this is going to be a little bit more difficult to do. So whenever you're checking the pulse, you ideally want to use a light touch using your middle and your index finger. You don't want to be pushing too hard. And whenever you are checking the pulse, you want to make sure that you're checking the quality of how the pulse is. Is it bounding? Is it weak? There are a couple of different sites that you can use to check the pulse, but the most popular, most common one is the femoral pulse, and this is located on the inside of the thigh. When you're checking the femoral pulse, you can do this with them standing or with them laying down. So if they're standing, you're just slightly going to move their upper thigh away from the lower part of their leg. And then again, you just go in with the 2 fingers, your middle and index, and try to get up as high on the leg as you can, right where that leg meets the body wall. Another set that you can use to check the pulse is the digital pulse. So this one is just below their wrist. So you will take their paw and locate the area that is just above the middle of the paw pad. So this will be on the underside of the front paw. Again, lightly touch it with the 2 fingers and start counting. Another option is the dorsal pedal pulse. Again, you can have your dog sitting, you can have them lying down. This one is located just below the ankle. So this one's going to be just above the middle pad on the underside of their hind paw. Again, lightly place your fingers there and start counting. The next vital sign is the respiration. So the normal respiration for a dog is anywhere between 10 to 30 breaths per minute. This is done by simply just watching the number of times your dog's chest rises and falls. You can either count this for the full 60 seconds or count it for 15 seconds and just multiply it by 4. If you're having a hard time determining if the pet is breathing or you're having a hard time counting, get a small mirror and place it in front of their face. That way, when they're breathing out of their nose or out of their mouth, you can count the condensation breaths that show up on the mirror. If you are using a stethoscope, you want to note how it sounds. So ideally, you should not be hearing any noises, no wheezing, no coughs. The next vital sign we're going to talk about is their capillary refill time and their mucous membranes. So their mucous membranes, their gums should be pink and moist, and their capillary refill time should be less than 2 seconds. So in order to check the capillary refill time on a person, you just pinch your finger. Once you pinch it, it turns white. As soon as you let it go, it should go back to its normal color. Now, whenever you have a dog, you're going to lift up their lip and push on their gums. So initially, their gums should be that nice pink color. Once you push, once you add a little bit of pressure, they should turn more white, and as soon as you take your finger away within the next 2 seconds, it should return back to that nice pink color. The capillary refill time just tells us how much blood, oxygen, and nutrients are actually getting to the body's tissues. Ideally, like I said, these gums should be pink and moist. You want them to feel smooth and shiny and slippery. You don't want them to feel dry. If they are dry or tacky, that's a sign of dehydration. Another sign of the dehydration would be if their eyes are sunken in, or if their skin does not just snap back after you do the turgor test. If you check their gums and they are not pink, that is an indication that there is something wrong. So you check their gums, let's say they're blue. Let's say they're the grayish blue color. This is cyanosis. This is a sign that they could have asthma, heart failure, low blood pressure, smoke inhalation, pneumonia, hypothermia. If you look and you see that they look very pale, more of like the white color, this is going to indicate possible asthma, shock, internal bleeding, clotting, bloat, metal poisoning, kidney failure, hypothermia, cancer. And if they're bright red, this could be an indication of gingivitis, some sort of infection, sepsis, high blood pressure, exposure to toxins. And if they're yellow, this usually means it's something with the liver. Same thing in humans. It also could be a sign of anemia. So that's the vital signs. Take some time and figure out how to check the vital signs on your dog. Figure out what is normal, and if you notice something abnormal, obviously notify your vet right away. Hopefully you found this helpful. I'm going to be making more videos around this topic, so be sure to stay tuned for those. As always, if you're not already subscribed, please make sure you subscribe to the channel because I do make a lot of great content like this here. And if you have not already, if you enjoyed this video, please make sure you give it a like. And as always, we will see you guys in the next video. Bye guys!